नमस्ते बिटिया, हमेशा खुश रहो बिटिया। Myself, Dr. ARTI Purohit, Associate Professor, Department of Pathology, Faculty of Homeopathic Sciences. Today we are going to discuss about the breast and its inflammatory disease. Normal structure of the breast. First we will talk. Microanatomy of the breast reveals two types of tissue component, epithelial and stromal. In a fully developed non-lactating female breast, the epithelial component comprises less than 10% of total volume, but is more significant pathologically since majority of lesions pertain to this portion of the breast. Epithelial component. The epithelial component of the breast consists of two major parts: terminal duct lobular unit, which perform the main secretory function during lactation, and the large duct system, which perform the function of collection and drainage of secretion. Both are interconnected to each other. The entire ductal lobular epithelial system has bilayered lining, the inner epithelium with secretory and absorptive function, and an outer supportive myoepithelial lining, both having characteristics ultrastructure and immunoreactivity. The inner epithelium stain positive for epithelial membrane, antigen, and albumin, while the myoepithelium is positive for smooth muscle actin, that is also called as 100. Stromal component, the supportive stroma of the breast consists of variable amount of loose connective tissue and adipose tissue during different stages of reproductive life. The stromal tissue of the breast is present at two locations, intralobular and interlobular stroma. Acute mastitis and breast abscess. Acute pyogenic infection of the breast occur chiefly during the first few weeks of lactation and sometimes by eczema of nipples. Bacteria such as the Staphylococci and Streptococci gain entry into the breast by development of cracks and fissures in the nipple. Initially, a localized area of acute inflammation is produced, which, if not effectively treated, may cause single or multiple breast abscess. Granulomatous mastitis, although chronic non-specific mastitis is uncommon, chronic granulomatous inflammation in the breast may occur as a result of the following. First, systemic non-infectious granulomatous disease as part of systemic sarcoidosis, Wagner's granulomatosis. Second one is because of infection, that is tuberculosis, which is not so uncommon in developing countries like India and may be misdiagnosed clinically as breast cancer owing to axillary nodal involvement. Tubercle bacilli reach the breast by hematogenous lymphatic or direct spread, usually from the lungs or pleura. Pathologically, typical caseating tubercles with discharging sinuses through the surface of the breast are found. Silicone breast implants implanted on breast cancer patient after mastectomy or as breast augmentation cosmetic surgery may rupture or silicone may slowly leak into surrounding breast tissue. And fourth one, idiopathic granulomatous mastitis is an uncommon form of reaction around lobules and ducts in absence of any known etiology. Exact pathogenesis is not known, but probably it is a form of hypersensitivity reaction to luminal secretion of the breast epithelium during the lactation. Mammary duct ectasia, plasma cell mastitis. The mammary duct ectasia is a condition in which one or more of the larger ducts of the breast are dilated and filled with ins, ins, inspissated secretions. There, these are associated with periductal and interstitial chronic inflammatory changes. Duct ectasia affects women in their at around 4th to 7th decade of life. The etiology of the condition remain unknown, but it appear to begin with the periductal inflammation followed by destruction of the elastic tissue to cause ectasia and periductal fibrosis. The condition appear as a single, poorly defined, indurated area in the breast with ropiness on the surface. Cut section shows dilated ducts containing cheesy, inspissated secretions. The features are: first, dilated ducts with either necrotic or atrophic lining by flattened epithelium and lumen containing granular, amorphous pink debris and foam cells. Second one is the periductal and interstitial chronic inflammation, chiefly lymphocyte, histiocytes, and multinucleate histiocytic giant cell. Sometimes plasma cells are present in impressive number, and the condition is then termed plasma cell mastitis. Occasionally, there may be obliteration of the ducts by fibrous tissue and varying amount of inflammation, as it is termed as obliterative mastitis. There is fat necrosis also in the breast. Local fat necrosis of an obese and pendulous breast followed by an inflammatory reaction is generally initiated by trauma. The condition presents as well-defined mass with indurated appearance. The excised lump has central pale cystic area of the necrosis, and there is a disruption of the regular pattern of lipocytes with formation of lipid-filled spaces surrounded by neutrophils, lymphocyte, plasma cell, histiocytes having foamy cytoplasm and frequent foreign body giant cell formation. There is one another thing. This is called the galactosele. It is a cystic dilatation of one or more ducts occurring during lactation. The mammary duct is obstructed and dilated to form a thin walled cyst filled with milky fluid. This is a reference I produce. This session is powered by digital version 2.0 JAYOTI VIDYAPEETH Women's University. I hope you all enjoy this session. If you have any query, please mention it in the comment box. Thank you so much. Bye bye.